Why can't I just have a regular cleaning? Is a question that we often hear from existing patients of our practice who have not been in for a few years, as well as new patients that haven't had a dental cleaning in a very long while. The answer is best understood if some basics of periodontal disease are explained. We know that gold gum disease is caused by bacteria that remain on the teeth and under the gums. Bacteria and debris left under the gum line, however, is the real culprit. Pocketing is a term used to describe how deeply the bacteria have traveled alongside the tooth. Normal is less than 4 millimeters. The problem with doing a quote regular cleaning in situations with significant pocket depth, that being 5 millimeters and above, is that a regular cleaning can only address the bacteria at the gum line and slightly under the gum line. In doing so, all the real damaging bacteria are left to do their dirty work at the bottom of the pocket. Your teeth may feel cleaner when you rub your tongue over them, but in actuality the disease process is left to progress. A very ineffective treatment, and is considered to be supervised neglect, according to the American Dental Association. The only way to access the damaging bacteria at the bottom of the pocket is by a deep cleaning. This is performed after your gums are numbed with local anesthetic and done in sections around your mouth. Once the pocket is cleaned, the gums are then free to heal and reattach to the tooth, creating a much healthier and sustainable situation.